Hi, everybody. Thanks for joining. So we're just going to give it a few minutes for everybody to come on board. Hope everybody had a good day. It's a Monday. It's an interesting Monday, not like any other Monday. Definitely not like the Monday from last week. And but it's important to kind of keep a routine, and I'm going to go into that today. But whilst we wait for people to come on board, just wanted to share with you what my day was like. And the aim is to keep my routine. So, as a physician, I'm able to keep office hours. Interesting, in the news, I think they're becoming much more restricted about people's movement. So the common landmarks that people might go to see locally here, the cherry blossom, they're heavily restricting people's movements now. So just the places that people are allowed to go now, the essentials like groceries, bank, medical facility, pharmacy, things like that. And so it's important to keep your routine, and we are allowed to go out. You just can't go out and mingle in large groups. So when I came back from my work, I was hungry, but I was diligent, got into my workout clothes, went for a little run, which I haven't done as often as I would have liked in the past, but now I have no choice. The gym is shut down. So it's a matter of really combining the outdoor with a little bit of indoor workout. I'll give you some advice on indoor workout for people who are following me with some future videos. So as people are coming on board, we'll give them another few minutes. And so, appreciate people joining us on a Monday night. Hopefully you're relaxing and they're not watching too much news, because the news can be a little bit depressing. But the news is where actually I can get some of my current information. As I said, you hear about where the masks going and what sort of supplies are in demand. And sometimes the news gives you quite a bit of information. So, for example, we can go. Yeah. So today we wanted to talk about stress in relation to what's going on with the COVID and the restrictions and what to do, what not to do. And so how stress affects the brain and how the brain is involved with the immune system. So first, if I explain the science behind it, then people might appreciate the gravity of some of the things that I'm going to advise on what you can do to kind of keep things on track, because the brain then impacts the immune system. There's a lot of science behind that. So what I would like to do is spend about 15, 20 minutes just giving you a summary of those systems in place. And then maybe if we can leave some of the questions to later on, then I'd like to be specific and pick out some really good questions, particularly to link those things together. So let's just give you some interesting facts about sleep, because it's overrated. So I have 5 pillars for almost everything, and it applies to even the COVID. If you want to boost your immune system, then you need a good night's sleep, and I'll give you the science behind that. And then if you put bad food into your body, your immune system's not going to be running on good fuel. And then the third thing is to put the good fuel in, the nutrients that not only feed you, but actually feed your microbes. And then, as we'll spend a lot of time on a future episode about supplementation, the science behind it, the main pillars. And so sleep is going to be in there if you want to protect your brain from stress. So let's give you a little science about stress. If you're stressed, it's very difficult for you to know how much you're stressed unless you have a physical body. What I'm trying to say here is that if your hands don't shake, your palms don't go sweaty, your heart doesn't beat, it's very difficult for you to sense stress. So if that's the case, then, keeping your body in physical condition is one of the best ways to manage stress. But what I was really trying to say is that if you are stressed, you can feel it in your body. But how do you know if your brain is under stress? Well, we have studies now to show that just like you can release cortisol around your body, you release cortisol in the brain. What it does is it activates a receptor called GSK, and that causes damage to the brain. Now, we can blunt that with a little bit of lithium. So I don't want you to going out there and getting a whole bunch of lithium at this point. I just want to educate you and then give you a sense that the brain doesn't have senses like the rest of the body. It doesn't give you palpitations. It doesn't, beat fast. You don't get sweatiness, tremor, fast respirations, your blood pressure. You just can't feel it, and that's one of the problems of dealing with stress. And so that's one thing, activating receptors that go to damage the brain, but it does it in a very insidious manner. The second one is when you don't sleep, the consequences are great. It's so easy to take it for granted, but let me just tell you what the consequences are. So what they found in a study where somebody was in the MRI going through the different sleep cycles, as they went through, the fluid in the brain called CSF, cerebrospinal fluid, was moving in a very synchronous manner. They timed that with EEG monitoring at the same time. And they found that as the neurons are firing, as you go through the different sleep cycles, it was actually increasing the blood flow or increasing the movement of the blood. And that correlated with the movement of the CSF fluid. Now, why that's important is that people who go through all the sleep cycles wake up rested. That's very, very important, right? And then what other technologies that we are aware of is that during your sleep cycle, your brain temperature drops by about 3 degrees. Now, people who wake up and not rested, their temperature probably didn't drop 3 degrees. We measure that through the transcranial cranial thermal tunnel. Not a lot of people are aware of that. So that's a few evidence that I was showing you about managing your sleep. Now, what is the power of having, a brain that's not under too much stress? What is the power of a brain when you give it adequate sleep? That's called the positive. It's called the cholinergic drive. The cholinergic drive is similar to when you go through deep breathing exercises, when you go through meditation. It's your brain, the central cholinergic system activates your immune system by going through the vagus nerve, interconnected to the spleen, and then connected to the gut of all places. And so why is that important? Because what they found is that when you activate it, you can actually reduce inflammation in the colon, like in Crohn's disease. And when you are able to cut that cholinergic sympathetic drive, you actually get inflammation. And they were able to do this in animal studies. And so it's very, very important that that brain is connected to the gut. And then what happens to the gut? The gut is the center that releases the serotonin. The 90% of the serotonin that's in your brain, it comes from the gut. 90% of the serotonin is in the gut, and what you get in the brain is related to that. And when the serotonin is broken down, you get melatonin. Now, isn't that an interesting concept? Instead of you thinking of melatonin as being in the brain, actually it comes from down below. And same with dopamine. So it's very important to have a healthy mind, to have a healthy gut, but we can actually act on each of these systems to keep things in track. So I went through a little bit of science. I don't want to bore you with that, but here is what I would recommend. In order to mitigate these things and keep your immune system tip-top so you can defend yourself against all viruses, maybe the COVID virus, but also, should you get infected by a virus or the COVID virus, you can recover faster. So it's very important for you to maintain the routine. The routine is actually a great way to minimize stress, because right now, our lives are being changed in ways that we may not be comfortable with. You may not be able to go to your usual coffee house. You may not be able to visit the people you want to visit and drop by for lunch as you would. Just your routine's been sort of disrupted. And that in itself is stressful, right? For some people can handle that better than others. So it's important to keep the best routine you can. So the things that you have control over. So one thing is positive thinking. Don't think of what you don't have. Think of what you have and what you can do. So it's important to have that routine. For me, I can still go to my workplace. But if you hypothetically didn't, wake up at the right time, go to sleep at the right time. Have a routine where you spend time with the family, and then another time where you're doing work around the house or work, and then have that time where you go out and do some exercise. So routine is really, really important, and staying targeted. So one of the studies that I actually saw, or actually the information that I heard about on public radio was, adults spend a lot of their time thinking about what ifs, what had happened before. And they plan ahead, what's going to happen? I need to do this. They don't live for the moment. And I found that very personally enlightening, and something that sounds so obvious, but like a few other steps that I'm going to go over, it's very important to just think about the moment and not think too far ahead, because sometimes you don't have control over that. That's anxiety provoking. Think about what may have happened and what ifs. That's gone. It's done. So live for the moment. And what they said is children actually live for the moment. They don't want to plan too far ahead. They don't care too much about the past. And so almost like we should be a little bit more childlike in that respect. So we talked about the power of sleep and the immune system. We talked about the brain as an organ and how it can be damaged by stress, by releasing and activating GSK receptors. We saw the power of the brain, how it can reduce inflammation by communicating, really. That's what it is. It's the interconnection between the brain and the gut. And so keeping your routine is very, very important. So one of the things I'd like to do is give you some advice on breathing technique. I've given this prior, and that activates the vagus nerve. So when you're stressed, and we are saying that stress can be activated from the brain, affecting the brain directly, and through cholinergic pathways, it can affect the gut, which is where a lot of the immune system is. The 90% or 80% of the immune system is right there. It's very, very important to be able to activate that. It's hard for you to work on the brain. We can do that through transcranial magnetic stimulation. But for you and I, deep breathing exercises, meditation. So one of the movements is a movement that controls the diaphragm. So when you breathe in a controlled manner, you're activating the vagus nerve, which controls the diaphragm. So in a way, you're activating that cholinergic drive. So when you do breathe in for a count of 3, and then hold your breath for a count of 4, and then breathe out very, very slowly for a count of 7, that's a total of 15 seconds, and that cycle can be repeated. So here, I'm going to do it myself so you can follow me. So when I breathe in, first I have to breathe out a little bit, and then breathe in. So it's a little hard for me to time it right, but a second is quite slow. So the idea is that slow movement, that controlled breathing in and the controlled breathing out actually activates the vagus nerve, and the heart rate starts to go down. The blood pressure starts to go down. So you could do that breathing exercise first thing in the morning when you wake up, because there's a cortisol drive in the morning, which is good because it wakes you up. It raises your blood pressure. It raises your heart rate. So you don't fall out of bed and collapse because you need blood pressure. But that cortisol drive can also, in people like myself, make your heart beat a little bit. So it's important to maybe do the breathing exercises. So I sit on the edge of my bed and I do a little bit of breathing exercises before I get up to go to the bathroom. And in the middle of the day, when you're kind of stressed out or you just want to reset, that's a good way to reset. And then at night, it's reasonable to do that too. So find maneuvers. If you are spiritual and you meditate or you pray, when you bow down, just control your breathing in your supplication. Control your breathing when you're doing your spiritual activity, whatever that may be. So that's very, very important. And then going back to other activities like going to sleep on time, waking up on time, that's called sleep hygiene. Maintaining a day-to-day activity of good diet, not eating the bad foods, because those are neuroirritative. So processed food, chemicals, the mac and cheese, the low end, that's got a lot of preservatives, a lot of coloring. That could be a problem. If you're going to feed your kids chocolate, try not to get the ones with too many coloring. They're neuroirritative. For adults, hot dogs, burgers, the things which are processed, they're going to have preservatives and chemicals which are neuroirritative. So when you wake up and you think you've slept 8 hours, 9 hours, you may not have woken up in a restful manner, right? And that's a problem. And so then the next point is exercise. Exercise not only is very good at relieving stress, because that's one of the maneuvers that I do, because oftentimes you hold your stress on your shoulder. And as I told you, if you don't have muscles, how can you feel stressed? You wouldn't have a knot on your back. If you didn't feel your heart, you couldn't feel the beating. If you couldn't perspire and sweat, you wouldn't know that you're under stress. So, then you must maintain that physical body, because the better condition that the physical body is, the more you're able to absorb the stresses of the stress, the effect of the stresses. So regular exercise is one where the muscles will be regular, because what happens is that as you activate your muscles and you relax, activate and relax, you're kind of massaging it in a different way without physically massaging. That's one way. The other way is you're releasing nitric oxide. So nitric oxide opens up your arteries, increases the blood flow. So you have greater blood flow to the brain, greater blood flow to the alveoli in your lungs, greater blood flow to the heart, greater to your muscles. So, having the exercise, what it does is that as the blood is flowing through the blood vessel, there is what we call a shearing force, just a physical, mechanical force. And as it moves through the blood vessels release the nitric oxide. The other way to get it is in your diet. That's what we say. Having a lot of greens is very, very good for you, because the greens have nitrates And then your acid will break it down into nitrites, or actually bacteria will break it down into nitrites, and then the acid in your stomach releases nitric oxide. So it's important not to be on proton pump inhibitors like Acifex, Prilosec, Protonix, but if you need them, that's one thing, but understand that, try to fix the problem so you're not on these medications forever. So exercise is a very powerful way to release nitric oxide. Exercise actually helps you relieve stress, but that nitric oxide has global impacts, not only on the blood flow, but actually the immune system itself as well. So going back to what we said about, keeping a routine, that's one way to relieve stress. And that routine means good sleep, protect your brain. And one of the ways you can protect your brain is taking not only lithium for the to diminish the effect of that cortisol surge when the brain is under stress. The other areas is to nourish the brain with the nutrients, which we describe as adaptogens. Adaptogens are, you're giving the nourishment to your brain, and the brain is able to resist. It's almost like when you have oxidation and you eat lots of fruits and vegetables, now you have antioxidants to resist it, right? And in the similar manner, when you have adaptogens for the brain, you can resist the impacts of stress. Again, many times you may not be even aware of these stresses. So the common adaptogens are like in your fish oil. Of the fish oil, we break it down to EPA and DHA. Now, the important thing to understand is that EPA is good for blood vessels and DHA is good for the brain. So having just a fish oil 2 a day would be great. But then if you concentrate on those products that have a good amount of DHA, which I like to take because I want to protect my brain not just from stress, I want to maintain my brain function so there is no cognitive decline, or the cognitive decline is minimized. And the other ways I can do that is making sure I have the right amounts of magnesium in my body. There are different forms, which I'll go into on another episode, of real dietary changes for the immune system and protecting the brain. When I talk about the immune system, I never talk about any one part of the body. They're all interconnected. So my job is always to give you brief summaries of the different systems and then give you the best science of the interconnection. So other ways to adapt the brain is something called phosphatidylserine. Big word, but serine is a neurosupportive nutrient, and it's very, very good. So magnesium, phosphatidylserine, fish oil, or DHA in particular, and the other one is a common adaptogen called ashwagandha. Ashwagandha has been known to help mitigate adrenal stress, which is again another form of another organ that deals with stress, and also is an adaptogen for the brain. So see how there's commonalities not only with products that are protective, but they're also protective. Talking about, did you know that the body cannot differentiate one form of stress from another? So let me list the common ones that I face. So not sleeping enough is a major, major stress. And that's why people with sleep apnea have low testosterone. They also have a lot of chronic fatigue, because that lack of sleep is a tremendous stress. The body responds to the stress by pulling on the steroid reserves in the body, and testosterone is a steroid. That's why it's so low in men, even if you don't have sleep apnea, because people don't sleep enough. And how many wives complain of men snoring? That's not a definition of sleep apnea, but it's not a good sign of restful sleep. And women would benefit from that testosterone. So women need sleep too, because half of the women have osteoporosis, and testosterone makes the bone stronger. In fact, testosterone is connected to the immune system. See how I keep connecting the different things, because that's how the body works. So I wouldn't want to talk about testosterone only. I wouldn't want to talk about sleep only. I wouldn't want to talk about the brain only or the gut only. They all work together. And so I'm giving you a glimpse into all of those things. So we're talking about how the sleep is important and not interrupting the sleep, and that stress. So let's sort of change pace. Let me give you the summaries here. That the main things is keep a steady routine of your day-to-day life. The better you keep the routine, the body stays in better condition. It's better for the mind. And then focus on the present. Don't think too much about the future. Don't think too much about the past. And then for the moment, you will break it down to the things that you need most, which is, if you're really smart, you break down to the present until to the point where Buddhists know how to control their breathing. They can control the breathing. They can control almost every part of the body. I was amazed by a study where Buddhists that went to the top of the mountains where sub-zero temperature with just one cloak, stayed all night long, came right back down. When they did the MRI on those people, they found different parts of the brain activated because they're able to control the brain. So really, we can always do something more. So now's the time to be able to explore meditation. And I don't do it myself, by the way. But I see the virtue of it. I see the science. As I'm getting older, I'm getting more receptive to it. But take a moment to live for the moment. And part of that moment is breathing. I demonstrated to you how those breathing exercises are so powerful. And so those are some of the key things. So soon I'll be taking some of these, some of the questions. So if people have questions about immune system, about stress, or about the brain gut connection, then we can go into those areas. But as you're thinking about this question, I just want to tell you about the COVID, that, avoiding by safe distancing, as washing hands frequently. If somebody is sick, they cover up or isolate themselves a little bit. Those masks are not that readily available. We barely have enough for our own staff. If we get more, we'll let you know, and then we'll be happy to deliver them to you. I wanted to spend just a few minutes just to say that, look, every time you get a fever, it's not going to be COVID. So as the advice that I gave before, seek medical advice before you just sort of make your own decision. Try to get a hold of your doctor or somebody in the medical field. And so the common things that I get asked all the time is, I have diarrhea now and a little bit of fever. What's going on? My own patient that I had, we weren't sure. We swabbed them for strep, we swabbed them for flu, swabbed them for corona. Nothing came back positive. But he had diarrhea, he had a little shortness of breath, he had fever. So we covered ourselves with everything, including isolating him, until the results came back where we said, okay, your symptoms have subsided. Your tests are negative. We don't have to isolate you anymore. Do you have any questions right now?
You can tell them to ask questions.
Yeah, so if you have questions, feel free to fire away. And then, so talking about real life situations, I think that, avoiding is one of the most important things. And what we're talking about is trying to give you some real life ways where you can be proactive with your immune system. And I think the brain is the number one. It's very difficult to be able to assess, many other things. You can do a blood test, you can check your temperature, you can do your heart rate, your blood pressure. As we're looking through those things, I'm going to tell you that even blood pressure is something that actually what I just read was of the 4 main pre-existing conditions where people who are dying. In fact, the number one obviously is cardiovascular. That means underlying heart disease, blockages, angina, some diagnosis of heart disease. Not everything is heart. For example, arrhythmia like atrial fibrillation is not the same as the typical heart disease. Heart disease generally, the 80% is blockages or decreased blood flow to the heart. And I found that interesting that was the biggest risk factor. Lung disease was about the same as high blood pressure and diabetes. So blood pressure, diabetes, and heart disease. Diabetes, blood pressure, and and respiratory problems came in at the same risk factor, but they were less than actual cardiovascular risk factors for death. So in those conditions, control your blood pressure the best you can, control your respiratory the best you can, and all those risk factors, control them the best you can. And then what we're talking about is as we go through the brain and diets and stuff, these are things that not only can you empower yourself for today, they will pay off later on. That same immune boosting will keep inflammation down. So the first question is, how do you stay energized and beat lethargy? Look at me, I'm full of energy. It's 9 p.m. So one of the things is the most important thing: do things that you enjoy, that you're passionate about. There is no rocket science because it's all a state of mind. And so although we talk about the diets and so forth, so positive state of mind, which is what we're talking about today. So how do you stay energized and beat low energy? Sleep, sleep, sleep. If you haven't heard it enough times, sleep. Not sleeping enough, like interrupted sleep, low testosterone. Actually, I lost my chain of thought. The other stresses that the body cannot differentiate is sleep is a stress, exercise is a stress. So exercising at this point in time is a bad idea, because you're going to be more prone to respiratory illnesses. And people with endurance sports like ultramarathon runners, combat sports athletes like MMA stars, UFC, I don't watch it, do I? Maybe I do. They have low testosterone. That's why they want to be on TRT, testosterone replacement therapy, because it doesn't matter whether sleep stress, endurance sports stress, emotional stress, family stress, work stress, the body cannot differentiate. The stress system gets activated from the head to the gut, and then you deal with the consequences. Acute stress is okay, but chronic stress is a problem. So you stay energized by sleeping enough, number one, then putting the right foods into your body and having a routine, the exercise. Another question? The next question is there is fear that coronavirus is airborne and it can travel through wind and how far? Well, that's a very good point. But let me tell you the practicality of it. I'll give you an analogy, then we'll try to decipher, because no studies have been done. Nobody can sit here and give you facts about this kind of stuff, but I can give you practical advice. So here I am dealing with real life people with TB. TB is a very contagious disease, TB. And so if I have a patient with TB in the room and the door is open and the air is fairly ventilated, I can spend 1 hour in there and not worry about catching TB. However, if the door is locked with a TB patient, I'm in there for 24 hours, there's a high chance that I'm going to react positive at some point, right? May not get active TB. So if you understand TB is quite contagious, that if I leave the door open, be in that presence for the individual for a period of time, that the risks are not that high. Now, we don't know much about the corona. That's why I can't be definitive. But let's now talk about flu. Somebody with flu, if they're coughing and I'm in that 6 foot vicinity, then I have a high chance of getting those aerosol air droplets in my oropharyngeal area, right? One of the ways the droplets, I've touched something and it comes into my face, or the other one is it's in the air, somebody's coughing. So your question was, somebody with corona coughing, I'll take my chances with that. I mean, that's my personal opinion. It's not evidence-based because no one's done this study, but in the air, there is much more volume, much more flow, right? So when they talk about isolation ward or isolation room, they have what we call laminar flow. So when you have a bug in there, what they want is to direct that air through a filtration system, one-way traffic. They don't want the room door opening and things coming out. So although outside is not laminar flow, but I'll take that flow over a static air in my office with the door locked. I hope that kind of gives you a sense. I would be much better at taking my chances in the open air than in a closed room. Okay, hopefully that answers. So how to overcome hypoglycemia and feeling lethargic all day? Interesting. Listen, the people that get hypoglycemia either have to be on medicines that pump out insulin in the pancreas, or they're taking insulin and the dose, if it's too high, will make them hypo. Those are the two classical cases. If people are on metformin or what they call GLP receptor agonists called Trulicity, Bydureon, Victoza, strictly speaking, you shouldn't be able to go hypoglycemic. Now, there's a true hypoglycemia where your actual blood sugar level drops below anything below 70, but realistically below 50, then you're really about to pass out, sweaty, and so forth. So if you're talking from facts with number reading and it's less than 50, you must be on some medication or some insulin, or you have a real dysregulated endocrine system, and you're a minority. So I would say seek medical advice, your primary care doctor, endocrine. Now, a lot of people feel hypo. What does that mean? If your body's used to a certain amount of glycemic level and there's a relative change, you feel hypo, but you may not actually be hypo if you measure it. So I would say that I don't know that that scenario of hypoglycemia leads to lethargy. For sure, hypoglycemia leads to lethargy, diaphoresis, that's sweating, dizziness, and at the worst, passing out. But that means when your blood sugar is under 50 generally, okay? And the lethargy that most people feel, there's two types of lethargy. The lethargy where you're exhausted from a workout, that's one type of lethargy, or the boredom lethargy, or when you're working all day long in the office and you're just so tired and hungry, that's a different type of lethargy. So I hope I didn't quite answer your question the way maybe you would have liked, but I've tried to differentiate the two, okay? So another question, let's see here. So is there any herbal supplements? Yeah, that's a good one. Is there any herbal supplements for anxiety? that combination that I was telling you about, that is good for the brain. I have one product at Next Health, so it has all those ingredients in it. So, in addition to ashwagandha, the magnesium, the phosphatidylserine, the fish oil is separate because you don't mix that in. The other one that's good is theanine. So theanine at 100 milligrams, 200 milligrams. Instead of taking it alone, like people take so many concoctions. They take the melatonin, the theanine, and the GABA. Instead of getting all these different ones, good companies will actually put them together because there's synergy behind them. Not too much, not too little. And again, you just remember, you make your own melatonin in your gut. You make your own serotonin. It's important when I talk about the diet and supplements later to really concentrate. So I would say theanine is very, very good for anxiety. There are many other herbals that I haven't mentioned because I'm not an herbologist, but the ashwagandha and those other adaptogens for the brain are very, very good. Another question. Okay, how do you, yeah.
Which one, this one?
Yeah, that's fine, I'll take that one. No, we just did that one, yeah. How do you determine when you will treat a young patient with hypertension with meds? Oh, very good. Oh, you read my mind. I just had, I don't know what you mean by young, right? Let me quickly dismiss the real medical problems. So when you are, say, under 20 or very young, and you have high blood, those people have super high blood pressure. We call that malignant hypertension because they have either coarctation of the airway, aorta, there's a narrowing of the aorta, they get super high blood pressure. That needs to be fixed. There's no way around it. Narrowing of the renal artery stenosis, they have super high blood pressure. You can have a tumor of the adrenal gland, Crohn's disease. All these are very, very rare. And they'll be picked up because those people will have super high blood pressure and very young. What I think you mean is somebody in their 30s with high blood pressure. I see them. Somebody in the 40s with high blood pressure. Usually men will present earlier because premenopausal women, their blood vessels are protected by estrogen and many other organs are protected by estrogen. And they have the same risk factors as men after menopause. So they'll have the same risk factor of heart attacks and heart disease as men after menopause. So most men will present a little bit earlier, women will present after menopause. However, of the two people that I'm treating, one is in the late 30s and early 40s, they're both women, premenopausal. So they have a family history, but what my workup shows that they have a lot of deficiencies. So when you have high blood pressure, it's because you've activated the aldosterone pathways. And we have medicines to block aldosterone itself. It's called spironolactone. You also have medicines that stop the production of it called ACE inhibitors by blocking the ACE enzyme. And and when we have more time, or maybe at the end, there's talk about the ACE receptor allowing COVID virus to go in, and that the NSAIDs are maybe increasing the ACE receptor. So if people have the energy and follow me to the end of this the live viewing, then I will explain the medical science behind it. But your question was about blood pressure. When you take vitamin C, when you take vitamin D, you are now suppressing that aldosterone release because you have now supported the pathway. When those pathway that releases aldosterone, which holds on to sodium, raises your blood pressure, when you're deficient in vitamin C, when you're deficient in vitamin D, that's one reason why your blood pressure will go up. One of the individuals that I've met had low citrulline. Citrulline helps release nitric oxide. It's an amino acid that you get in watermelon and you get in other melon family like cantaloupe. There are probably other fruits that you can get citrulline from, but it's an amino acid that assists in releasing nitric oxide. And this individual actually had low levels of amino acid. So almost inevitably, no matter what condition I treat, whether it's autoimmune disease, cardiac disease, diabetes, when you look at the basic nutrient level, and I do it through measurement, half the battle is just replacing what the body needs. The next is dealing with a little bit more complicated issues, like identifying other reasons for blood pressure, like inflammation. And if you address that, you're now getting to the root. So that's what you mean by lifestyle. As a physician, as an MD, I use lifestyle, but I use the metrics. I use data, and I use the science of the things I've just talked about.
I want to ask, at what age should you stop taking estrogen? What
age should you stop taking estrogen? Wow. That's not quite related to this conversation. Let me give you a quick answer. So when you're young, your body is ready to take the advantage of estrogen for childbearing. So your cells proliferate, your uterus proliferate, your breast tissue proliferate. Proliferate means to grow, multiply. However, when you're postmenopausal, that's why your hormone level comes down. It's supposed to. And so the question is, how old should you be when you stop estrogen? When you're postmenopausal, you have to be very careful and work with physicians who understand this. Because if you overstimulate the proliferation, you're now potentially stimulating breast cancer, ovarian cancer, and uterine cancer. The fact of the matter, if it's good quality estrogen given carefully, it's not going to do that. But xenoestrogens, which come from the environment, like plastics and pesticides, they mimic estrogen. They're toxic estrogens. What they do is they go through the metabolic pathways and they stimulate or create DNA damage. And that's why those kind of estrogens are different. They cause a lot of problems.
Someone wants to go live with you.
Yeah, let's go live with somebody. Someone's going to go live. Let's have some real live interaction here. All right. Do we have somebody live here? Let's see. Yeah, it looks like it. Yeah, no, not quite. As we're doing that, I'll share the other question, which is a good one, about autoimmune disease and respiration. Okay. Okay. Whilst we're waiting for that, let's go ahead and answer. If we go live, then I'll interrupt my conversation. So somebody had a good question about autoimmune disease. More likely, the people with autoimmune disease, they're more likely to suffer from respiratory damage. Look, I'm not going to be a downer. I'm not trying to make you feel bad, but it's important to control your autoimmune disease because most autoimmune diseases are inflammatory. That's why we call it inflammatory bowel disease. Lupus is inflammatory. Rheumatoid arthritis is inflammatory. These are global inflammation. Clearly, each of these diagnoses have specific parts of the body that you notice the inflammation. Is it the bowel? Is it the joint? Is it the skin? And for something like rheumatoid, for sure, it can go to the lung. And lupus as well. I'm going to go in live here with my friend over here. How are you?
I'm good. How are you?
Good. What's your question?
So, I've had hypoglycemic reaction 5 times, and I went to ER 3 times. All my blood tests were normal. I don't know what caused it, but I've been feeling lethargic all day. Even when I wake up, I feel lazy. I just don't want to do something. I just want to lay in bed, but I'm not sleepy. Even if I lay in bed, I just feel tired all the time.
Okay. So I got tiredness. I think I've got the fact that you went to the hospital a few times, and that you either they diagnosed you or you diagnosed yourself as hypoglycemic. So what was the sugar level when you were
55?
Got it. Okay. So quick answer, because I'm looking at you because as a physician, I try to make diagnosis. So you look young. I don't see pigmentation, but I will look for pigmentation for autoimmune disease. There's a lot of things with pigmentation related. So when I see somebody that yo-yos with a low sugar, the question that we ask ourselves is maybe you're yo-yoing high and your body's trying to rectify it by producing excess amounts of insulin, and it overshoots and makes you temporarily go down. So that just may be a warning sign to say that maybe you've got hyperglycemia going on, high sugars, and your body's trying to overcompensate you going down, because that's the most likely scenario. Again, I would say that you're one of the rare people, again, because of your youth, you're not type 2 diabetes, that's for sure. And it makes sense about type 1. I'm not saying you're type 1. I'm not making a diagnosis over the phone, as you can tell, but it definitely warrants you seeing somebody like a primary care doctor. If you're not having luck, then communicate with me somehow, some way, and I'll guide you through who you can see, where you can go, or I may get engaged with it. But it's just a warning sign. At least you've got something that's a warning sign. Emergency rooms are not the best place. You've been there enough times. Now it's time to find out what's going on and fix it. Okay.
I mean, I've got a referral to endocrinologist. I still have to go there and get further checkup for if it's not insulinoma or anything like that.
Perfect. That's fine. In the meantime, the advice that I have is cut out the refined stuff. So don't be eating the sweets and sugars and refined stuff. And that might help. It might help. It may not help, but it certainly will be good for you. Okay. All right. Good talking to you.
Energized.
Yeah, I think once you regulate the sugars, your energy will come back. Right now, what happens is that if your sugar is over 200, which I'm not saying it is, but if it was, it's toxic to the cell, so that it doesn't feel good. When you're hypo at 55, you don't have the fuel in the cell, so clearly you don't feel good. There's something going on. We've got to find out what it is. You're too young for this. All right, thanks for the question. We'll go to the next question here. Anybody else going live? And just going back to autoimmune disease, that anything inflammatory not only creates inflammation in your lung potentially, but actually is the number one, doubles your risk of a heart attack. So diabetics have double the risk of a heart attack. People with lupus have double the risk of a heart attack. People with rheumatoid have a double risk of heart attack. People with inflammatory bowel disease have a double risk of heart attack. And the problem is the rheumatologists and the GI doctors are not explaining the cardiovascular risk. The number one reason for people to die is heart attack. The number one reason for a man to die is a heart attack. The number one reason for a woman to die is a heart attack. The number one reason for a cancer patient to die is a heart attack. And that's why inflammation needs to be nipped in the bud. So stay tuned for the stuff I talk about, what not to eat and what to eat, because that's the way to keep inflammation down. So that's a passionate request to stay tuned for future stuff. So I think we have another good question here. Does being overweight put you at risk of autoimmune disease? Okay, I'm going to keep it simple. I used to be overweight, so I can speak perfectly about it. There's two types of overweight. You can be overweight and healthy, and you won't get inflammation, and you won't succumb to the problems. You can be slightly overweight, and you're unhealthy. You're going to have inflammation. You're going to have all the bad impacts of why obesity is associated with increased cancer. Obesity is associated with arthritis. Obesity is associated with autoimmune disease. So the type of obesity you're talking about makes sense. But if you're a healthy person and you understand about good diet, you understand about good gut, you understand about good detoxification mechanisms, how to engage your liver, which, I would say 50% of my patients must be overweight. They're not like, they're older and they're a little bit overweight, but not a single one will have serious health problems because I make sure that I assist them in being healthy.
So, but their diabetes has still not reversed.
Okay. So the question is that they've lost weight, but the diabetes hasn't reversed. In fact, it got worse.
Yeah, it hasn't just reversed.
It has reversed.
Still the same.
So they've lost weight. So this one again is one of those that it's called the bell curve, right? So your sugars kind of get high, your body can match the insulin. There's a point where the insulin production is at its peak. Then now your sugars may be high, but your insulin is dropping. What happens there is that when you don't have insulin or you have inadequate amounts of insulin, your sugars are going to be high because you can't utilize the sugar. But the biggest problem is that your body turns to fat to look for fuel. So people lose a lot of fat, but for the wrong reason. Like if you're not trying to lose weight and you've had diabetes, usually these are the people that have had diabetes for a while, or one where they go to insulin-dependent diabetes. So that's a warning sign of somebody going into insulin requiring, or we call it insulin dependent diabetes, where the insulin, the fact that you need the insulin and you're not making enough of your own, if you don't get external insulin, then your body will break down the fats. And so that may be a point of, I hate to say no return, but I'm saying that the reserves are very low. So now you've got to engage everything to do with not only your diet, you've lost the weight, but hopefully you've done it because you wanted to do it the right way. That's where you have to activate every tool available to overcome insulin resistance. That means whatever insulin that you have must be fully engaged, fully active. That means addressing numerous markers that create insulin resistance, like high free fatty acids, low adiponectin, high leptin. First, you measure these things, then there's protocols to address them. That's the way we minimize insulin resistance and we maximize your insulin's ability to be useful. So whatever little you have, you can maximize it. All right, a lot of good questions. And so what advice would you give for a disabled person overweight? Okay, try to just keep a routine. So you are disabled, but you have ability for something, right? So at home, I lay down and do sit-ups at times. I know this sounds maybe melodramatic, but you've got to look at what you're capable of and make the most of that. So I don't know where your disability is. Is it a limb? Is it a leg? Is it, so my mother, I'll give you a real story. My mother had a major stroke, a weird stroke. It's a thromboembolic stroke, nothing to do with her diabetes at all. No blockages in her neck, nothing. My point is that she recovered after being in a coma for 5 days, but she had, after losing function in 3 of her 4 limbs, she regained the function except for one leg. The lower leg couldn't move. So she goes to the gym 3 times a week with me. She just struggles through because, once you lose one limb, it's not that easy to run around. It's very difficult to even go up a flight of stairs. So basically, despite her disability, she's doing the best that she can. So my advice is, look, I appreciate you have disability. Look at what you're able to do and optimize that. Okay, I mean, look, this is a complex one. Sleep is very complex, but usually what you find, and I may recognize the person, the problem is that it doesn't happen overnight. It's when you have poor sleep hygiene for a period of time, now what happens is that the wiring in your brain has changed. You've got to unwire it. It's very difficult. So the best thing I can tell people is that when you voluntarily choose not to sleep, whenever the opportunity comes, get back to sleep. When you've been on medication like Ambien for a year, good luck trying to get your sleep back even when you go off Ambien. So my thought is that try to find out the reason why you're not able to fall asleep, you stay awake. So the sleep hygiene is that routine, as I was telling you. Try to go to sleep at the right time, wake up at the right time, exercise in the daytime. Don't put additives, preservatives in your food. Eat good food. So what I would say for this gentleman is you have trouble going to sleep at night, and you may be up until 2 or 3 in the morning. And if you have a lot of work problems in your head, you got to address that. If you have other stresses, you have to address that. My advice is that start to clean up the diet, and then from that start to improve the activity. And what I would say, just take step by step by step, and then you could try the things that have a combination of theanine with GABA. And that also has some melatonin in it, and adaptogens. So I've got somebody live. Was live. Oh, sorry, we lost that. Let's see if anybody else wants to go live. Okay. Yeah. So a quick question. I'll give you a quick answer. Is idiopathic urticaria considered autoimmune? Then quick answer is no. Idiopathic means we don't know. How to lower your insulin? Interesting. Well, I don't fully understand the question, but when you have refined carbohydrates, obviously sugars and something sweet, even fruits, or refined carbs like pasta, rice, then those become sugar, so you have a surge of insulin. And so if you want to lower your insulin, don't put those foods in. That's one way of looking at it. And what you might be leading to is that high insulin is actually a driver for many problems. So high insulin drives insulin resistance to some degree, so it encourages blockages. High insulin drives hormonal pathways that create PCOS, polycystic ovarian syndrome, which is synonymous with low progesterone and high androgens, like testosterone type. Androgen means testosterone-like. And so high insulin is postulated, and more than postulated, at driving cognitive decline in the brain. So high insulin is synonymous with inflammation. In fact, if I have somebody with inflammation, I look for the different causes of inflammation. It's never one thing. So if they have insulin, that's easy. I'm going to try to find the ways to lower the insulin, and you'll find inflammation will come down. And that's why inflammation and insulin resistance go hand in hand. That's why if you have inflammation, it's harder to control your sugar, because inflammation makes your insulin less effective. So hopefully that kind of answers the question that you were asking. And, hopefully that's all related to stress, because, that stress impacts your gut and insulin resistance. And so indirectly, it has everything to do with all the common medical problems. And so you mentioned earlier about foods to eat that help reduce the risk of inflammation. Where will you advise your advertise your? Okay. Well, if you want to find about that, could be universally good. So the whole turmeric root. If you get organic, eat the skin too. Each and every component of the turmeric root is beneficial in a spectrum of ways. So, number one, curcumin is a flavonoid. We've always known that's good. It reduces inflammation. The fibers are what they do is they stimulate bacterial diversity, and bacterial diversity can lower inflammation. And in the turmeric root, there are so many different other types of flavonoid. What they found is instead of breaking out and only utilizing curcumin as the one type of flavonoid, eat the whole curcumin, and you will get many, many benefits from lowering inflammation, better gut function, better inflammation in the gut, reduced inflammation in the gut. And anecdotally, I used to hear this from people that just took the spice, we call it haldi or turmeric spice, and they would just mix it with a little bit of milk or mix it with something and just drink it. And they said they felt very good. The joints felt better. And now that makes sense because the whole turmeric root is far more beneficial than the curcumin that's extracted from turmeric.
Just one final question.
Okay, final question. Please talk about leaky gut syndrome and a reasonable diet plan in the future. Okay, very quickly. Leaky gut means that the tight junctions that are burden on the liver, you also have now stimulation of the immune system. And so that creates a whole bunch of immune complexes around the body. So in short, there are multiple reasons for leaky gut. There's no one way. We can test for it in the stool. We can test for it in the blood. That we call zonulin. But don't worry about that. I would tell you that not sleeping enough, stress, bad diet, these all contribute to leaky gut. Food sensitivities either contribute or are created because of leaky gut. So the simple answer is, go to sleep on time. Don't put bad foods in. Put the good foods in. Those whole foods that have their fibers, these feed and nourish the bacteria. So that turmeric isn't just the curcumin and the flavonoid, it's that fiber that's in there. So fibers come in onions, it comes in garlic, it comes in leeks, it comes in artichokes, spring onions, all sorts of good vegetables, beets, and the list goes on. I just mentioned those first few because those are actually kind of special, by the way. And things which allow fermentation to take place in the gut. So whether you have kimchi, sauerkrauts, apple cider vinegar, miso soup, things that allow the fermentation process to be facilitated is very, very good. So those are the ways to mitigate leaky gut. But one quick one would be, there are special protocols where we use immunoglobulins, and there are non-dairy versions of immunoglobulins derived from bovine milk, but no dairy. And then you can also make sure that you put the right combination of probiotics and digestive just to make the gut healthy, okay? That's the best way to get rid of leaky gut. And then something about Hashimotos too. Well, Hashimotos, is definitely autoimmune, a lot to do with the gut, a lot to do with food sensitivity. So I would say a clean diet is very, very important. Not everybody needs to be gluten-free, but I would tell you it's the rule of thirds. In medicine, we have the rule of thirds. The third is that 1/3 of the population, nothing's going to happen to them. Doesn't matter how much, and Donald Trump may be one of them. It doesn't matter how many fried chicken he eats, he may be just fine. And there is 1/3 of the population that's just falling apart. I'm probably one of them. If I touch that stuff now, I will fall apart. And in the third in the middle, they're suffering, but they're suffering quietly because either they just deal with it because this is their norm, or they seek advice, but the doctor says everything looks normal. So that's the kind of rule of thirds that I would say about these kind of things. All right. If anyone's still here and they wanted to know about the ACE receptor, I can't imagine anybody would really want to know about the ACE receptor, but let me work backwards for you. So we have a blood pressure pill called an ACE receptor blocker, right? Angiotensin converting enzyme. So lisinopril was the original ones. Now we have angiotensin receptor blockers, ARBs. And so you may be familiar with Cozar, Avapro, things like that. So that same ACE receptor that I've been talking about with Motrin does the opposite. So Motrin increases the ACE receptors. So what they say is that this COVID virus enters the cells through these ACE receptors. But forget COVID just for a second. What I'm about to tell you is actually quite profound. So here we are using an ACE blocker, angiotensin converter blocker, the old-fashioned one or the new ones with the receptor blocker. Here we are blocking it. And so what does NSAIDs do? Motrin, aspirin, naproxen, they're blocking the effect of the ACE inhibitor. So here, somebody could be taking blood pressure pills and they could be on taking anti-inflammatories because of their arthritis. And hopefully the doctor asks these questions. In fact, when I was a young doctor, that was many years ago, like 30 years ago, people with borderline heart failure, if they took anti-inflammatories, they would go into a heart failure because it would raise their blood pressure and they'll go into heart failure. So we knew that a long time ago, even without knowing the full mechanisms. So now I'm going to tell you about the ACE receptor. So it's anecdotal. It may be there, it may not be there. But the question was, should I take Motrin when I have a virus because I may be encouraging corona? My answer is, if you have a fever from any cause, a regular virus, a flu virus, or a coronavirus, don't take any Motrin at all unless you absolutely have to take something, and that something might be Tylenol. Because the fever is actually the way to boost your immune system and activate your immune system in a way to help you recover. So you dropping your fever with an NSAID is not the right move, maybe Tylenol, but I don't give Tylenol to my kids unless they're suffering. So having a fever is good. But if you have the fever where you're just suffering or you can't sleep, I'll give it to you then. When I had my flu for the second time in my life, this Christmas period, I only took my the Tylenol at night so I could just sleep for a few hours because I was waking up every hour or two with body aches and chills. But in the daytime, I just suffered through it. Now, I'm not saying everybody has to suffer through everything, but my point is Tylenol is safer, and don't try to bring down fever just because it's 100 or 101. When it's 102, even that's not that high, but everybody's different. But when it gets to higher than 1 or 2, then you might need to, because with the fever, you feel very bad. Fever, chills, body aches. So that's the thing about the ACE. So ACE receptor, what's more important than this coronavirus is don't take NSAIDs if you have heart disease. Don't take NSAIDs if you're taking an ACE, angiotensin converting inhibitor like lisinopril, Cozar, losartan, because NSAIDs encourages the coronavirus. The point is that don't take the NSAID if you don't have to take a Tylenol. And what else? I'm not going to go into the argument about hydroxychloroquine and Zithromax. When I get more information, I feel it's useful, then I'll give you information. Right now, I think it's just, if people have hope with it, that's fine. And when you're sick, all bets are off. Take whatever you want to get better. On that note, I'll just say that if people have access to ozone, and the way to take it, I'm not going to mention in public, but ozone is antiviral, ozone is antibacterial, ozone is parasite, antiparasitic. So in other words, having ways to harness ozone in different formulations is probably more of an active treatment. And I'd heard that in China, they're using IV vitamin C, which is no surprise to me. IV vitamin C works so effectively for the monovirus. It doesn't work for every other virus necessarily. So I would say that each virus is different. This is so new that nobody knows really. And I think that if there's something that people want to try, particularly when they're sick, absolutely go for it. But there are other things you can do. So to keep your lungs in tip-top condition, for people who have access to hyperbaric oxygen chambers, that's a great way to keep your lungs tip-top. It increases oxygenation. It supports the lungs and every other tissue in the body. It detoxes your mitochondria. It activates your immune system. That's a way to do it. Hypothermia through saunas. It's really an intermittent stress. So when you're having intermittent fasting, it's a stress, activates your immune system. Hypothermia from saunas, intermittent stress, activates your immune system, good for the immune system. Hypothermia, cryo, intermittent stress, activates your immune system. We don't have a lot of literature on it, but I suspect it'll do the same thing. So intermittent stress from high intensity interval training also activates your immune system, and you only have to do it for like a minute or two in your workout. So these are the things that we can talk about down the line. It's not really for today. I don't know how many people are still here. They don't have anything better to do than listen to me yapping away. If there's any more questions, we can take it. Please talk about leaky gut. That's it. Dan, Hashimotos. Anything else here? Anything live? No. Okay. Well, hopefully you'll join in on the next one where I will probably talk more about the diet. I think Thursday I'm going to go live again on a little bit on the diet. Then we'll go through those lifestyle things that people talk about, but I'll bring in the science of it. It's important to have those those pillars that I talk about. They're good for sleep, good for the immune system. There's a lot of science behind them. So with the science, I'll hopefully give you a few techniques. And so just if you become conscientious and conscious about these things and really take it seriously, this is a great opportunity to improve your overall health and well-being in these trying times. So thanks for staying tuned, and hope to talk to you soon. Take care. Bye-bye.